What is the definition of ADHD, and how does a child with ADHD differ compared to a neurotypical child?
I usually have a conversation with the families that I see around the fact that on the one hand, ADHD is a real disorder which has evidence scientifically of biochemical differences, structural, functional differences in the way the brain works, which translates into real effects in terms of attention, in terms of behaviour. But at the same time, it is part of the spectrum of what normal, I use the word spectrum in terms of the normal range of what normal childhood behaviour is. So what we are identifying as ADHD now is a problem relative to the expectations that we place on children, especially in the school environment where they have to be able to keep still, focus, sit and do their work. And not every child has a strength in that area, the same way not every child has a strength in sport or music. So because we don't have a blood test or a brain scan for saying what is and is not ADHD, the way, like many disorders, the way we actually identify and define what is ADHD, which stands for Attention Deficit Hyperactivity Disorder, is based on a clinical definition. So it's based on a picture that we see whether a child fits. Nowadays, we talk about ADHD as the overall condition, and then we break it down into either predominantly inattentive, which are kids that have problems with focusing, concentration, daydreamy kids, and kids that have got ADHD, predominantly hyperactive impulsive. Hyperactivity, which is fidgeting, not being able to keep still. People often say climbing the walls. And impulsivity, meaning a child that does things on impulse without thinking, often manifesting as interrupting, doing things without thinking. And then there's combined type, which is also very common, where they have both effects. And the way we define what is ADHD is by looking at whether a child has enough symptoms of the condition, and there are set symptoms. There's actually 9 of each of inattention, which is attention problems, and hyperactivity, impulsivity. And a child's got to have at least 6 out of 9 of those occurring often or very often. And this is all based on the DSM-5, which is essentially a rule book of behavioural and developmental conditions and psychiatric conditions. In ADHD, in addition to having those symptoms, it's also going to be having a significant effect on the child, either academically, socially, or behaviourally. It's got to have started from a young age, and it's got to be developmentally inappropriate. It also has to be present in more than one setting, so not just school or not just home, but all across the child's experiences. And it's got to not be due to another cause. And each of these things is very important in actually making a diagnosis, because we have to look at everything to do with the child's experience. We have to look at their sleep, their diet, what's going on for the family, what's going on for that child emotionally and behaviourally. So that's essentially how we decide on whether a child has ADHD or doesn't.